Hello and welcome back, everyone. I hope you enjoyed your lunch break. Let me just wait a few seconds until everyone is returning. Okay, so welcome back, everyone. I hope you all enjoyed your lunch break. In the first in the morning session, we had two very exciting presentations, and I'm sure that the afternoon session will be exactly the same. And we are going to move to the second part of the session today, which is on the COVID-19 research. And I would like to pass on to Martin Kahnetz to present his paper, The Impact of Mass Antigen Testing for COVID-19 on the Prevalence of the Disease. Martin, the floor is yours, and you have 40 minutes. You will get a 5-minute reminder.
Thank you. Thank you very much. Good afternoon. Let me share my screen. And now, could you please give me a signal where you see the slides and where you hear me?
Yes, we can hear you and we can see the slides.
Excellent. Thank you. Thank you very much. I'm very pleased to have the opportunity to present this paper on the impact of repeated mass antigen testing for COVID-19 on the disease, on the spread of the disease. This is joint work with Lukáš Lafers and of Matej Bale University in Banská Bystrica in Slovakia, and Bernhard Schmidt-Peter from the University in Linz. And what we're doing here, we're clearly from the societal perspective and from the economic perspective, obviously as well, the ongoing pandemic is a serious, very serious issue. As of just checked yesterday, and there was 164 million people infected and more than 3.4 million have died because of COVID. And this is, of course, just official statistics. We know from analysis of excess deaths that the actual numbers are much higher than what we see in the statistics. Well, the response to the pandemic was varied around the globe, but in general, governments try to impose restrictions on mobility to slow down the number of infections, and this included various milder forms or stricter forms, contact tracing, PCR tests to trace contacts and find the cases and try to remove them from circulation, quarantine them, and slow the pandemic. Lockdowns where whole sectors in the economy were shut down. This was, hospitality was closed in most countries. And obviously, if you throw a lot of sand in the wheels of mobility, daily lives of people, then this has a heavy toll on the economy. So we see the last year, we saw a serious slowdown of the global economy, and some of the mostly advanced economies were heavily affected also in economic terms. Now, some countries have started to think about ideas how to actually avoid the need to close the economy and to restrict mobility so harshly. And the logic of one instrument, namely mass testing for COVID-19, was quite appealing, because the idea being that if you identify positive cases and quarantine them, well, that sounds like a good idea. You slow down the pandemic. There is less of a contagion and less of a transmission of the disease, and that should mitigate the pandemic and allow the government to keep the economy open, and then have minimized the economic but also human costs, psychological costs on individuals. Excuse me. However, it's as always a bit more tricky than that, because well, of course, if you think about this mechanically, you remove cases from circulation and their contacts, etc., etc. That should slow down the pandemic. But that's not the only consequence of mass testing, because what you do in the process is that you distribute test results. So it's not only that you identify positives and give them a signal, okay, you're positive, stay at home, but you also distribute negative certificates, and people respond to that. And so their behavior changes, and such certificates, also because they're imprecise, but also because they just simply give this false sense of security, this may result in people taking, engaging in more risky behavior under the assumption that they don't have the virus. But then this has a negative effect on the spread of the pandemic, because people simply take less caution in interactions, and this then may possibly even reverse or counteract the effect of removing the positive cases. Now, of course, the key question empirically is which of these effects prevails. Whether it's the removal of those who are positive from circulation, quarantining them, or the latter of changing behavioral response to the tests. And what we do in this paper, we explore a quasi-experimental setting in Slovakia, which conducted mass testing of its whole population as the first country in the world in a nationwide scale. And we identified the impact of repeated mass testing on the incidence, test positivity, and spread of the disease. That's the whole logic of the paper. And I'll now give you a bit more detail. Sorry, the slides are a bit heavy in terms of what they contain, but I trust you'll be able to bear with me with a little bit of details about the quasi-experimental setting, because this obviously is the key to understanding what we are identifying, which effects we are identifying and which not. So what happened in Slovakia? In autumn 2020, the situation, which maybe I should start a year ago, is about a year ago in March, Slovakia recorded the first case, and then in April there were some cases, but retrospectively Slovakia practically did not have the first wave. The number of positive cases were in total number over the first 5 months of the pandemic was just about 1,600 cases or so, and this is a country of 5.4 million, so the incidence was really low. Slovakia took some early measures, shut down some sectors, sent kids home office, etc., which slowed down the pandemic early on, and we practically did not have the first wave. And the summer was really nice. People hanging around, very few cases, single-digit numbers of cases per day were recorded, and the numbers of tests were not the highest in the world, but still very solid and relatively large number of tests conducted every day. But the number of cases was really low. The situation started to change in September, October, and November. In October, the situation was already quite scary, at least given the practically no first wave. politicians and the society was stunned by the steeply increasing numbers in late September, October. And so the opportunities or alternative measures had been considered, and among those rapid antigen testing, nationwide mass rapid antigen testing. And so what happened was that on October 31st and November 1st, the first wave of testing was conducted, where the population from 10 to 65 years of age, and also those above 65 if working, was targeted by mass testing. This was about 80% of the whole population. The testing was voluntary, but practically not getting tested was very costly, because all positive cases, their households, self-trace recent contacts over past 2 days, and also, and here comes the why testing was very costly, those without a negative test certificate were quarantined. So to be, all those who were positive or their households and contacts were quarantined, but also those who were not able to present a negative test certificate, they had to quarantine for 10 days. And if anyone violated the quarantine, there was a fine of about 1.5 of average gross monthly wage in the country, 1,650 euros. In effect, in the three waves, I come back to that in a second, 3 waves, somewhere about 83 to 87% of the eligible population was tested. More than 5 million rapid antigen tests were conducted, and as I mentioned, Slovakia has about 5.5 million residents. What happened, as for the waves, there was a pilot testing in 4 districts where the situation was considered to be more serious. There are 79 districts in Slovakia, just to give you a reference. 4 of them were selected for pilot. And just for the reference, the tests were only antigen tests were conducted. There was no PCR test post-verification. And there are some who argue that, and there was a general fear about that when the mass testing took place, that the imperfect test specificity and sensitivity may be problematic for antigen testing, and because the signal is maybe very noisy, and there will be too many false negatives and too many false positives. So it's a nationwide mass testing takes place. So it's mass discussion about this, but maybe also to avoid exposing this problem to the public, no PCR post-verification was conducted, and so we didn't know how specific and sensitive the tests actually were. Only later we learned about it with full results, but at the time of the testing we didn't know too much about it. After the pilot, the first wave was conducted on October 31st and November 1st, and here comes the crux of the quasi-experiment. After the first wave, there were several tens of thousands of positive cases found, and the mass testing was, on the one hand, presented by the government as a fantastic way forward and a way how we can tackle the pandemic. On the other hand, it was very, very heavily criticized, and the government had the intention to conduct the second wave, retest, nationwide again, or just some districts, but there was it was not known until November 2nd whether the second wave would take place and in which districts it would take place. So what happened on November 2nd is that the list of districts which were to be retested was announced. These were 45 districts, and the threshold that was set to decide which districts were going to be retested was set to 0.7. So all districts with a test positivity in the first round about 0.7 were retested. And I can tell you from in the media, I actually reviewed all the news about this around the time, and even on November 1st, two ministers said there was not going to be second wave. It's impossible. The infrastructure is not ready, and so it was quite it was quite unclear whether the second wave would take place or not. And what we're doing in this paper is that we identifying the effect of the second wave, exploring the 0.7 threshold as a quasi-experimental setup, distinguishing treated and non-treated districts. Literature review, very briefly, not to take too much of your time on this. Already before the test, there was several studies which proposed that rapid antigen testing may be a way how to mitigate the pandemic with reasonable costs, at reasonable costs, at least compared to lockdowns and massive economic costs of some mobility restrictions. There was a study led by Michael Mina and several studies actually, which proposed that mass testing may be a way forward. Of course, mass testing as such, just identification of positive cases, that's never sufficient. What has to follow is the quarantining, and Atkeson et al. They show that whether mass testing is effective depends on public compliance with quarantine. Obviously, that's a very important variable here, and that there could be a counteracting effect, which is that testing can work, but it also makes people feel safe, and then it effectively may actually increase the range of social networks, may increase mobility as people feel more secure. There was another paper arguing in this direction. A paper by Platiel et al. They argued that rapid testing may be effective, but it has to be conducted in short time intervals because the effects are only temporary. And well, let me skip the other. Let me just jump straight into a paper which is closest to ours, in that it actually does look at the Slovak case, does look at the Slovak mass testing and evaluates in impacts. This is a paper by Pavelka and his colleagues and his team, came out in 2021 in Science. And what they did is that they modeled the impact of antigen testing on the spread of the virus using several methods and a micro simulation model. They found a significant negative effect. Of negative meaning mitigating effect on the pandemic of mass testing. So positive in a sense of mass testing being an effective tool of mitigating the pandemic. Paper by Mahasi 2021 points out that Pavelka et al. They actually did not disentangle overall trends and what we can call true impacts of the testing, and that's where we actually. If I can move on to the next one, that's where we actually differ from Pavelka, because our approach is because our approach is quasi-experimental, and we are trying to identify the impact of testing as causal. So when we compare our approach to Pavelka et al., what Pavelka's paper does is that they use the test positivity or test results from the mass antigen testing, and they compare the first wave and the second wave, whereas we use passive PCR testing surveillance data. This is the data that is actually reported in statistics. This is the standard testing that all people who are suspected or who have some reasons to get tested, and that they either can go to get tested, or they are advised by the doctors, or they are required because they cannot go to work or cannot travel. They get tested, and this is the standard testing that's done in all countries. and we use those PCR tests, not the mass testing itself. What this actually implies for us is that in the paper by Pavelka and his colleagues, comparing the two different ways, the testing the first round and the retesting the second round to each other, is a bit of an issue, because if the positive cases in their contacts were quarantined in the first wave, they were not retested in the second wave, and so the samples, there's arguably really large samples, but still the samples that were tested in the first and second round were not similar. There was a structural systematic difference between the two waves, as all those who were positive or their contacts or their households were not retested in the second round. More interestingly, maybe because we use results from PCR testing, these are daily data. So what we can look at as well, and beyond what Pavelka et al. Could do, is that we actually look at the duration of the effects. We can look at the dynamics or the patterns of the effects over time. And I think I also covered the second point here. So these are the two points. Well, maybe actually one more word here. Because, whereas Pavelka et al., they look at they compare first round results and second round results, and they try to the difference, the change, they try to explain as a effect of the first round of testing. What we do is that we compare retested districts to those which were not retested. Yeah. And that enables us to isolate the effects of retesting, and this means finding positive cases and then quarantining them, including their households and close contacts and those non-tested, from nationwide measures, nationwide lockdown, nationwide school closures, ban on gathering, ban on hospitality services, etc., and any other overall trends affecting the whole country. So that's another difference between our papers and Pavelka's in terms of interpretation of what we are finding. Now, to help you visualize what we are talking about, this is the map of Slovakia with districts. You can see 79 districts. In the left panel, you see the 4 districts in the north of the country. These were the piloted districts, 4 pilot studies. Then the red ones are those which were retested. So these were the districts with relatively high test positivity in the first round, and then they were retested in the second round. And then the bluish districts are those which were tested in the first round but had a test positivity below 0.7, and they were not retested in the second round. Correspondingly, in the right panel, you can see, test positivity in the first round. You see the darker, more reddish regions are those with relatively high incidence. The more kind of yellow regions, those are with regions with low incidence. And so you see quite some variation in the data there. So there are 3 types of districts. All of them were affected by nationwide non-pharmaceutical interventions. But then there were those which had a pilot and then 2 ways of testing, the 4 districts in the north. Then there were those which had just the first wave, and these are the bluish ones. And then there are those districts which had 2 waves. And the comparison that we are exploring is the red districts versus the blue districts. So the data that we have are from the Institute of Health Analysis, which report daily numbers of infections by districts. as well as number of conducted and positive PCR and rapid antigen tests. We use two measures to measure the pandemic: a 7-day rolling average of infections at a district level, and the reproduction number, how many additional people one infected person infects on average, that we calculate comparing data from over 7 days compared to the same window 5 days back. It's a simple measure of the reproduction number, but we also look at two alternative measures, and the results are very much the same. I'll come back to that in a few moments. As I already mentioned, this is important that the mass testing results are not included in the calculation, the analysis, how we calculate our outcome variables. We employ a difference in difference model where we compare treated and non-treated districts prior to the second wave, and then 14 days after round 2. And we look at whether there has been any difference in differences. Here you can see, this looks maybe a slight bit scary, because here we have the red and bluish lines, which represent a number of cases per 10,000 people, 7-day averages, and it's smoothed using GLO's method. And here we actually look at both PCR and antigen passive surveillance tests results. And the red ones are the retested districts treated. The blue lines are those which only went through the first wave of testing, first round of testing, and the thicker lines represent averages of the respective districts. What you see is that, well, it's raw statistics, but 14 days after the second round, and if you can see the pointer, 14 days after, this is the difference at the time of the second round, and this is the difference 14 days down the line. You can see that the difference diminished, meaning that the situation relatively improved in the districts which were retested. Same if you look at the reproduction number, same idea, and you see that at the time of the second round, when the second round was conducted, the districts which went through two rounds of testing had a worse situation, but it actually slightly reversed 14 days later. And so again, it looks like from these very simple raw statistics, raw trends, that the mass testing improved, retesting as a second round actually improved the situation in those districts that were retested relatively to those which were not. Well, we can run the model that I introduced a few slides back. And when we look at the whole sample, we see a statistically significant negative impact of retesting on the spread of the pandemic. Negative meaning in terms of infections, but of course that's a very positive result as to whether mass testing may be an effective tool of actually mitigating the pandemic. There is a bit of a question here though, because one could say that, well, we are mixing too much here. There's too many districts, also those which are very different. Their pandemic situation is very different in those districts which, more cases, people behave differently. There may be more rural or urban, or there may be other intervening variables which make the comparison, the threshold 0.7 not very much in line with our premise that it's a quasi-randomly set threshold, or it's threshold which is as good as random from the perspective of the districts. It could also be that for some reason people in districts with relatively high prevalence actually knew that they are a high prevalence district because they could see many friends and relatives sick, and maybe they expect it to be retested more than people in low prevalence districts. So what we do here is that we look at a narrower sample of districts which are closer to the 0.7 threshold, arguing that, well, if you are really close, it's you are more similar, districts are more similar, and expectations were more similar, and the trends were probably more similar in districts which are closer to the threshold. And so here we plot the districts, we sort them based on the test positivity in round 1, and then we set we restrict the sample 0.6 from below and 1% from above. And then we rerun the analysis for the subsample of districts. What we find is the following. Essentially, and I could show you also diagrams, but it's essentially the same. Essentially, we're getting the same point estimates, but lower precision. Now, of course, lower precision is not surprising because we have fewer observations, so that's not very surprising. But still, it's point estimates are of similar magnitude. And now the question is, how should we interpret this result? Same point estimates, but less precision. So let's be fully transparent about that. And what I show here is that what we do is that we re-estimate the model. And we plot here the coefficient for varying group sizes. I mean, the varying samples. Group sizes meaning the population in the treated and non-treated districts, meaning we are changing the thresholds of districts that or the band around the 0.7 threshold that we are including in the analysis here, from really small sample, just a few districts here, to the full sample up here. And what we see is that the effects are relatively stable, slightly increasing here when we include some large districts, and here as well, relatively stable, and the precision is obviously improving, and after a certain threshold, we start getting significant statistical significance for the number of cases and for the reproduction number too. Meaning that, well, this is something that one could expect here, that if there is some significant effect of testing on the spread of the disease, if you take too few districts, the confidence intervals are rather large and you're not getting statistical significance. Although from the quasi-experimental perspective, well, around the 0.7 threshold, that's a nicer, neater design, but there is a certain trade-off, and as soon as you include a sufficient number of districts, you get more precision, and then you're getting significant results of mitigation of the pandemic using the well, due to retesting of the whole population, of the entire population. So basically what we're finding so far is that the second round of retesting, reduces reported infection cases by about 30%, and the reduction in reproduction number about 0.3. The estimates become statistically significant if we include districts representing about 1.3 million cases for the number 1.3 million of inhabitants, citizens, for the analysis of cases, and 0.8 million citizens for the reproduction number. One of the advantages or values added of this paper is that we are able to look also at the dynamics of the effects or the duration of the effect of testing. And so what we're doing next is whether we are trying to see how initially we assumed 14 days after the second round. We look at 2 weeks, and there were some arguments why this is the case, because we looked at the time lag after the results are reported, and so we sort of look at how well people actually get tested. Then it takes some time until they get the test results, and it takes time until the results are in statistics, etc. So then how long it takes for the symptoms to develop. So we guesstimated that 14 days would be a right time horizon to look at, but we want to test that a little more, and want to understand that a little more, how the impacts, how the duration of the impacts might be. And so
this is your 5-minute warning.
Thank you. And so what we do here is that here we plot the for 2 different sizes of sample sizes in the upper panels. This is for up to 1.2 million people included, and in the lower panels this is up to 1.8 million people included. We look at the pattern of effects for different number of days after the second round. So this is 10 days after the second round, 15 days after the second round, 20 days after the second round. And what we find, long story short, is that, well, let's look at the lower panels, just for the sake of explanation. We find that about 2 weeks after the second round, the effects peak. They get statistically significant here briefly for the reproduction number, kind of the same pattern, but all the effects dissipate after, well, 2.5, 3 weeks after the testing. There are no effects detectable in the data. Again, the same main message. Of course, this is not yet sufficient, because we wanted to look at the data from different angles. We conducted several placebo tests and several robustness checks. So we thought, okay, what if we look at a fake threshold of 1.2%, 0.5%? What if we look at a fake treatment date instead of November 8, which was the true treatment date? Let's look at the data as if the second round took place on November 1st. And in all these placebo tests, we find no effects. And let me see whether I have a table here showing you. Okay, so this is for a placebo test. Instead of 0.7, which was the true threshold for treated and non-treated, here we have 1.2%. And you see very, well, some change, but not much change, less than previously. And here, and this is actually interesting, I wanted to show you this diagram. For the for the reproduction number in the bottom panels, you see this is a placebo test and absolutely nothing. Yes, no effect whatsoever. Now this is more interesting because here it looks like you find an effect here. Yes, in the placebo test. But the interesting part is that the true placebo test is only here in the left panel. Now what happens here is that because as we're expanding the bands around the fake threshold, we actually start including those districts which actually were not treated in the first round. Sorry, were not treated in the second round, and so here placebo stops to be placebo, because somewhere at this point, no. In the placebo test, we are actually spoiling the placebo by including those districts which were not treated. Up to this point, we compare only districts which all of them were treated, and we just fake a situation as if they were not. But here we start including truly treated districts, and we see that we are getting some effect. And so, but this is actually supporting the interpretation that the placebo test is supporting the main results of the analysis. For the test,
warning.
1 minute, excellent. This is all I need. For the test, instead of PCR and antigen testing from the passive surveillance test, we look at only PCR tests. We control for mobility. We control for population density. We exclude some larger cities. we consider two different alternative calculations of the reproduction number, smoothing out the 7-day pattern, the weekly pattern, and all the effect says about essentially no, all the analysis survives all these tests. Conclusions: 14 days after the second round, new infection decreased by up to about 30%, and the RT reproduction number decreased by about 0.3. The dynamics, that's an important result, that the impact peaked circa 2 weeks after the second round, but then it dissipated. And our robustness checks and falsification tests, placebo tests, they support the validity of the key results. I stop here. Maybe just one more thing. The policy implication would be that, of course, we're not looking at value for money. We're not looking at from the policy perspective, we would need to still do a little more analysis whether this is the whether this is the best or not approach. But purely looking at the results, it seems that mass antigen testing can have mitigating effects of the pandemic. But if more sustained mitigation is to be achieved, then it has to be repeated regularly, relatively often, relatively frequently. And this is in line also with the suggestions in previous studies, which say that, well, it could work, but it has to be repeated frequently to have sustainable effects on the pandemic. Thank you very, very much for your attention.
Thank you very much, Martin, for this very interesting presentation and very, very relevant topic to allow us to stay ahead of this pandemic and provide information for the decision makers to be able to stay ahead of the curve. So I would like to invite anyone who has any questions related to this topic. Feel free to type it into the chat box or raise your hand, and then you can also ask Martin. So Klaus has posted a question, can this be done on a routine level? Perhaps in the future we need this.
Well, this is a big question, very heavily debated in Slovakia, much opposition to this. I can say that I think this very much contributed to that our prime minister was replaced. He was downgraded to finance minister, and the finance minister became prime minister. And this was the starting point. The mass testing was it puts a lot of strain on the society. Slovakia mobilized, I believe, tens of thousands of soldiers, tens of thousands of people in municipalities which were helping, and medical staff. And so these were I don't remember the exact numbers, but this was over hundreds of thousands of people who had to actually help, and this created a lot of political backlash, and also much frustration in the society. Was quite a heated debate about whether this was actually effective. So it wasn't clear. There were some studies, including ours, which show, and then there, more recently there is a study by Mirko Tonin and his colleagues who look at Italy, more like surveillance testing, not exactly what we did. But all of these studies seem to suggest that there is some mitigating effect. And we show that it's not very long lasting. I think Mirko Tonin and his colleagues also show this, that it's only a temporary effect. But observing the situation in Slovakia is just one observation practically, but the political backlash and the resources needed, and here I don't mean the direct cost of tests. This was relatively trivial, a few millions, yes. But the human resources, the political capital that was invested in this is enormous. So the kind of consensus that's emerging here in Slovakia is that, and not only here, not only in Slovakia, there seems to be more a bit broader consensus that mass testing can be a way forward, but the benefits of mass testing are larger if the prevalence is relatively high. And so, yes, but don't do nationwide, but select only those districts which are in the, set some threshold, minimum threshold for testing, and implement it only in those regions where the benefits are sort of worth it. Yes. Yeah. So that's one. Also, another principle could be that do it there where the behavioral response to testing is the lowest. Yes? So people don't change their behavior too much with negative test certificate. They don't change the behavior too much. So you could stretching the argument a little bit, but there will be testing at schools, at companies, as in factories. You can test people regularly. There, the benefits might be greater than in an average population. I'd say so. The answer, sorry, long answer but short. Yes, but do it smartly. And also, maybe one last point here. I think the details matter very much. If you distribute negative certificates which say you don't have the virus, then it's really bad, because then those people start misbehaving as they take all the risky things. But if you tell the positives you're positive, and the negatives are like, well, we couldn't find it, but maybe you have it, still be a good citizen or something like this. I mean, or you even say inconclusive. Yes, you can say, of course, people are not stupid. Yes, they would realize that inconclusive means that they couldn't find it. But details may matter. That the negative test certificates are actually just saying inconclusive, or something that doesn't give people an impression that they are at no risk, and they can yeah, Klaus, please.
Yeah, but yeah, fine. I understand that. Now, one issue is certainly effectiveness. Yes, does it help in general? But the other issue is also, can we find out about new versions of the virus? Yes, I mean, we have to face the fact first. All these things, vaccination, we have no vaccination, but maybe rumors have it. It only holds for half a year, and then we will need new shots and maybe different shots and so on. So there must be a system, maybe in the future more than in the past, of relatively maybe more random based to identify what are new versions, and second, okay, to give at least people who need it a chance to travel and move around. And this is where we are now going. I mean, we are talking about in Europe about a passport for vaccinations. The Israelis already have it. Or, well, if you go shopping nowadays in some of German states, yes, if you have a test, I mean, I can go to the haircutter, but I need to have a test. And so on. I mean, okay, these are all not the same types of tests, but there will be a market for tests, and people will maybe at the end willing to pay. I think somehow you may have to establish such a kind of broader system, if at least as a potential, if you don't get wonder medicine vaccination at some site, and then you see these kind of studies like you have done it. Might help to guide us a little bit more. I mean, can this be more? Can this guide us more to have a routine procedure which is acceptable at the end? Yes, to people, just to avoid cheating.
Yeah, I think so. And actually, this is what Slovakia has implemented. Besides the two large waves of mass testing, one in the fall and then another one in the winter. We had this passive surveillance, which was not only the PCR test, but there were also antigen tests. And for example, to send our kids to school, we had to get every week, we had to get tested. With the antigen test was for free. Slovakia spent half a billion on this over the past few months, 500 million euros on this testing, and this has and I frankly believe this was helpful. And now the question is whether it was worth the half a billion, well, and all the resources. Okay, that's another question. But I think it was helpful. We don't have yet firm evidence about that. I know the study by Mirko Tonin and his colleagues, they did it for Italy, and they do find that it was helpful. But one important element was actually missing here, which was communication, and there was an enormous political backlash against this, and they actually stopped the practice. So I believe, yes, I agree with you, Klaus. There may be ways how to actually implement mass testing or highly accessible testing that can be, and conditional testing. If you want to go to hairdresser or whatever, that you need to get a test, all of that, and this can be combined with vaccination. Yes, either you're vaccinated or you get a test. All this. I agree, but where Slovakia failed, I believe, was the communication of this, and winning people's hearts, so to say, or support was a bit neglected, and this got highly politicized, and as a result, it failed politically. Yes, maybe not in terms of effects, but politically it was a failure.
Thank you very much for the very extensive answer. And there is just a comment from Ionis that in Greece, self-tests are used by students or employed individuals in order to allow business as usual. And this is indeed a very welcome practice that other countries are doing it so. I've also seen it in Austria, which is a regular practice that you get tested once or twice in every week. And I think it helps at least understanding the spreading or the motion of the pandemic within a country. We still have about 9 minutes from the Q&A session for this particular presentation. If you have any other questions that I'm very happy to read, or you can just put your hands up and ask Martin yourself.
In the meantime, as people are thinking whether they have another question, 2 short comments. One is that what people feared initially was low sensitivity and specificity of the AG testing, which turned out to be not very much of a problem, at least not as much as was feared. The test actually proved to be rather good in terms of being able to identify positive and negative cases and not to report too many false positive, false negatives. So this was good. Where most of the fear was the distribution of negative test certificates. So whether in the mass testing waves or in this passive surveillance everyday testing where people got tested, commentators were very much fearing the negative effects through negative test changing behavior of people, and then they became behaving taking too much risks, suboptimal large risks in their interactions and mobility. So yeah, exposed in the data, we found all of the few studies that are out there. They find a mitigating effect of mass testing on the pandemic, but the cost can be, political cost especially, can be very large. And so one has to not only have a sort of technical solution, but also a political solution, how we can actually do this without too much of a political backlash.
So if there are no further questions to this particular presentation, I'll just give you another second to think if you have any questions. Then we are a little bit ahead of time, and then we can move on to our next presentation. So no further questions. Well, thank you very much, Martin, for this very interesting research and presenting it for us. Our last presentation for today is by Alexander Kritikos, the Research Director for Entrepreneurship Research at the German Institute for Economic Research in Berlin, and a professor at Potsdam University. Alexander, I pass to you to hear about your research on COVID-19, the crisis of the female self-employed. You have 40 minutes. I'll give you a 5-minute reminder, and then we have 20 minutes for questions. The floor is yours.
Thank you very much, Martin, for the kind introduction. Thank you all, of course, very much for having me invited to this excellent workshop, and I'm really happy to join and add some insights which we were able to generate for Germany, and where I believe it would be also interesting to see whether this also holds for other countries. let me start with a small comment before I start with the presentation. The presentation is in general about self-employment, but with a very strong focus on female self-employment. And we should say that the data analysis which I present here is mostly based on the first wave. So the question is, of course, which comes up, how about the second wave? And this is, at least in Germany, a very interesting thing. In the second wave, the restrictions hit the self-employed as much as in the first wave, with two differences. The one is it didn't take only 2 months, it took 4 to almost 6 months for some of them, and some others are probably out of business for a year or even more. The interesting thing, it's interesting because at least in Germany, this effect is almost hidden and covered by the general impression that we're getting well through the crisis. The numbers are showing north again, showing upwards. The whole industry, so to say, the manufacturing industry is working as if nothing is happening, and the strong negative effects on self-employed in general are almost covered by this dynamic that the workplace seems to work relatively well, and that the pandemic is only affecting us in our, so to say, everyday living. And so far, having said that, also at least for Germany, we have let's say, an interesting discussion on whether this matters that self-employed are hit by the crisis particularly strongly, and how to respond to it. That's, so to say, my comments before I start presenting my joint research, which I've done with 2 colleagues from our institute, Daniel Gräber and Johannes Seebauer. And we analyzed indeed how the COVID-19 crisis affected the female self-employed. And you will see in a minute why we focus on the female self-employed. Let me make one spoiler in the beginning, right away from the beginning. It's not that female self-employed are more stupid than male self-employed or something like that. It's a different mechanism which we find. I'm saying this also because when we presented the work in the social media, there were strong reactions why we are looking at female self-employed, whether the main reason is that they are more stupid to run businesses or similar, let's say, not really convincing comments. Well, the first line you probably have heard now for a dozen times every day. Indeed, the COVID-19 pandemic has affected and still affects every domain of our life. The main problem is that in the absence of pharmaceutical interventions, the only way to slow down the spread of the virus is to limit contacts. And here we come to the crucial point already. Many industries depend on individual contacts. And the interesting part in general is that in those industries which strongly depend on contacts, we observe a much higher share of self-employment in general. What has not been revealed so far is, however, the second fact, namely that self-employed women are much more likely to work in those industries exactly which need physical proximity than self-employed men. The relationship is 91 to 68%. The other factor in particular when we discuss why self-employed need an additional focus is that, at least in Germany or in many other European countries, the employees were shielded from income reductions during this pandemic, because when they were not able to work, in particular during the first wave, they could have been sent into Kurzarbeit, into the short-run employment schemes, which in Germany in the first the first wave of the pandemic reached an unseen height of 8 million people having been sent into Kurzarbeit. Now the question is, which we cover in our paper, is on which we focus in our paper, is there, beyond the fact that self-employed are hit more strongly by this crisis than employees, whether there exist gender differences in the effect of the COVID-19 among the self-employed, whether there is, so to say, a gender issue which needs additional and particular attention. Let me give you in the beginning, so to say, a short overview of our main results. Indeed, we find, and this is what others find also for other parts of the world, in general, self-employed are more severely affected by the COVID-19 pandemic than employees. What we are indeed is we are the first to show that women are more likely to report income losses due to the COVID-19 pandemic than men. And there is, and this is the other interesting point, there's no evidence of a similar gender gap among employees. So this is a gap which only exists among self-employed. And the main reason is exactly what I mentioned before. Women are working disproportionately in industries that are more severely affected by the COVID-19 pandemic. Industries are, so to say, moderating this relationship between gender industries are also moderating the relationship between gender and working time reductions. Last but not least, what we also show, and this is crucial when we discuss policies which might help to survive this crisis, what we also find that the main reason for this difference is that the regulation which were done by the governments and the restrictions which were done by the governments are the main reasons why this gender gap arises. This is insofar important as also, of course, other effects could be observed, like demand side effects, supply side effects, but it's exactly the regulation, the restrictions, which unleash this gender gap effect. Let me start with a short review of the literature. What we add to, there are a couple of first papers which are focusing on the labor market and the onset of the crisis. But the main point of all these papers which I mentioned here is they either do not differentiate between self-employed and employees, or they focus only on employees. So there is basically little or no evidence on self-employed, with the interesting fact that those papers, in particular Adams, Brassel et al., who focus on the whole labor market, identify already a gender gap when they look on the overall employment effects of the crisis, but they do not go on and further differentiate where exactly this gender gap is. We also have a couple of new papers who look on self-employment during the crisis. Blundell, Machin for UK, Fairley and Kalinkowski for the US, and Belland et al. For Canada. And they all also observe indeed that self-employed are in general hit more strongly by the crisis than employees, simply because of these industry effects, that industries are affected by the crisis, which are facing or having more often or a higher share of self-employed people. These other papers or these other researchers had, however, data limitations. They had no income data, so they couldn't make any further analysis with respect to whether there's a gender gap. And of course, I don't have to mention that more deeply, there's a huge literature in general on the gender gap in labor market, and this is our paper, so to say, adding a very specific part in this context. Let me introduce you shortly to the data, which might be interesting also for you. I think these data should become, during this year, generally accessible, and also therefore accessible for country comparisons. some, let's say, people with foresight in our institute started in March to plan among the Socio-Economic Panel, which is in our institute situated, started to plan to run an extra survey. And they chose, so to say, a random sample of the whole population to be surveyed about their experience during the onset of the COVID-19 pandemic. And the topics which were covered in this survey were relatively broad. We have not only labor market experience is covered, but also health issues, the family and the household situation, also the question how time was used, and how the pandemic affected satisfaction attitudes. The first field phase was in the beginning of, or during the first wave of the pandemic, mostly in April, May, it was covered. Some later tranches were surveyed until July 2020. And we had a second field survey, which is finished 2 weeks ago, so that we are able to continue this research on this very specific COVID-19 survey on the Socio-Economic Panel. The information which we use here is, on the one hand, we had introduced three outcome variables. The first one is to what extent did a person experience a decline in gross earnings? The second one is did they had any reduction in weekly working hours, and did they have to change from working in an office to working from home? On the other hand, which is so to say very important for us, is we also were able to cover information what kind of restrictions the self-employed experience, whether they simply face supply shortages because some preliminary products were missing, whether they faced demand shortages because, so to say, demand was reduced because of the pandemic, or whether they were simply directly affected by regulations and restrictions. For those who do not know the Socio-Economic Panel, it's a huge household panel which is surveyed since 1984. We have rich information on demographics, labor market experience, household situation, etc. And the good thing is what we can link, so to say, this specific information from the sub-COVE data to the all exogenous pre-crisis information. Among that, for instance, all the demographics, but also information like personality, the household context, education, or what is of course also important for us, the industry affiliation. Let me shortly tell you what kind of methods we used for the estimations. We used simple ORS regressions in order to understand the contribution of each of the covariates. We used a relatively new decomposition method, the Gelbach decomposition, which has the advantage in comparison to the blind or Haka decomposition that it is invariant to the sequence of how covariates are introduced into the analysis. Having said that, let me come to the results. I start with some descriptive statistics, and we see in particular the share of people who faced an income decline. And you see here on the left side the employees, on the right side the self-employed. The dark color is males and the light color are females. And what you observe right away, even in the first period where we saw a huge number of people being sent into Kurzarbeit among the employees, the share of self-employed which faced income losses is much higher. Among the female self-employed, it was 63%. Among the male self-employed, it was 47%. So that we also observe not only this huge difference between self-employed and employees, but also among the self-employed. When we look into the reduction working hours, the differences are not exactly as high, but still very high. And again, females are also facing a higher probability of facing a reduction in working hours. When we look on remote work, there is a slightly different approach. Still, self-employed are more likely to also have been changed to work remotely, but now the change was more often hitting the males than the females. Let me come with that, having said that, to the main results. And I'm starting with the regression results on all self-employed. And we always use the three outcome levels: an income reduction, a reduction in working hours, and the necessity to change to home office or to change working from home. And on the left column, you always find, so to say, the raw difference, and in the right column, the difference is when we add the control variables. So the interesting point here is when we look on all self-employed compared to all employees, we observe indeed a 40% higher probability that self-employed faced an income reduction, a 30% higher probability that they faced a reduction in working hours, and a 6% higher probability that they were forced to go into home office. The other point here is certainly, which is also interesting, we are not able to understand why this difference is by adding, so to say, these individual characteristics, so neither demographics nor personality nor the NACE code, so to say, the industries, the specific industries were responsible for this. We can simply say that there is an overall stronger effect for self-employed over all industries where they were working in comparison to employees. So this is basically an industry fixed effect result, but which of course is not our main result. This is only to set the scene, as we are looking more on the difference between males and females. This is just to set the scene and say, in general, self-employed were hit more strongly by the crisis than the females. Coming now to the comparison of female with male self-employed, we observe indeed a 70% higher probability of an income loss. We don't observe any significant differences with respect to working hours and home office when we compare the two gender. But the other interesting thing here is when we add, so to say, the control variables, we become able to explain these differences between male and female self-employed. And when we look on the Gelbach decomposition, the simple, pure main reason why female self-employed are hit more strongly by the crisis than male self-employed is simply by what is covered by the NACE fixed effect. Simply, they are working exactly in those industries which were hit by the crisis, in particular, given these restrictions and to contact other people. So that we are able to explain these differences between male and female self-employed simply by these NACE codes. Coming back, so to say, to the general picture, whether this also, whether this correlation is also observable when we look into employees. And here we exactly observe this difference between self-employed and employees. We see the higher the share of females among the self-employed, the higher the probability that they face income losses. Whilst when we look on employees, we don't see any such relationship that an increase in the share of females in a certain industry increases the probability of an income loss. We further looked into what policy indeed induced this difference. And again, we observe here another strong difference, which only holds for restrictions by government ordered restrictions. We observe a much stronger effect among females in comparison to males, but we don't see any difference with respect to supply shortages or demand effects. Again, when we add the control variables, the difference between males and females become insignificant. And again, the reason is the industry fixed effects, and the NACE codes, which explain the difference between males and females that had been affected by these restrictions, that explain the difference in the probability that females face a higher income loss than males. Having said that, we also made some further analysis, which I would like just to present here very shortly. We checked whether there are differences in terms of absolute and relative income losses. So say we looked not only on the losses at the extensive margin, which is our main interest. We simply wanted to know whether self-employed were affected by income loss or not. Looking more deeply into it, so to say, into the losses at the intensive margin, we observed that males faced larger income losses in absolute terms. Females faced larger income losses in relative terms. Certainly, some issues here with statistical uncertainty. This is why we don't look more deeply into this. We also find a further interesting explanation. We wanted to know to what extent it also could be that beyond this effect of the NACE codes and the restrictions on female self-employed, whether there are also other potential explanations for the fact that females face a higher probability of income loss. And the other explanation could be that in households, at least where two people had incomes or had jobs or were self-employed, and in those households where these families had also children, it could be that the person with the lower relative income, which is more often the female than the male self-employed or the male partner, that the female self-employed with a relatively lower income would then be more ready to reduce the job in order to take care for childcare and for homeschooling. And indeed, we find here some additional explanations that using the relative income in the household, that this also is significantly related to an income decline. So say females with a relatively lower income had a higher probability that they also faced an income decline. So that could be also an additional potential explanation for the reason why female self-employed were hit more strongly by the crisis than male self-employed. Let me finish with some outlook. The important, which is from our point of view, an important part as well when we look into long-term effects, and if you also look into the question how a pandemic needs, let's say, a more complete view. The non-monetary, the consequence of the pandemic did not only result in financial losses. It is also relatively obvious that, in particular, females in general were facing three kinds of pressures. It was not only the income loss, it was also that they were having the burden of homeschooling and indeed of connecting the home office with these two other burdens of financial losses and homeschooling. And the question is, to what extent does this also affect the mental health of the individuals in general or the females in particular? And this is where we also can make use of the SERP-COVE survey. This also includes a patient health questionnaire, which measures anxiety and depression, and which can be linked to the SERP data, which measured this PHQ-9 score 1 year before of the pandemic. And so to say, I would like to close this analysis with also looking a little bit into this part of our analysis. which is, I think, pointing to important future research. Let me start again with some descriptive analysis. We observe here in the PHQ-4 score from 0 to 12. 0 is that you have no mental health issues at all. 12 is that there's a high issue with your mental health in terms of anxiety and depression. The dark color is the pre-crisis level. The light bars on top are what has been added through the crisis, and indeed we see a shift to the right, so to say, a higher incidence of mental health changes to the worse, so to say, incidence for or signs for depression, anxiety. And we also observe that the mean and the median increased between 2019 and 2020. What we did then is we looked into the changes for males and females and differentiated between employees and self-employed, and again then between those with and without income losses. And what we observe here is, so to say, on top is always the self-employed, on the bottom is the employees, and on the top of the top is those without income losses, and then those with income losses. Overall, what we do observe among female self-employed, that they had a very significant increase in the frequency of depressive symptoms. Among the females without income losses, it is already significant, but it is particularly strong among females with income losses. And we observe indeed an interesting fact among the males. There's absolutely no sign of an increase in or a decrease in mental health or worsening of mental health among the male self-employed. When we look among males, the only strong difference is here among the male employees, particularly those who were sent into Kurzarbeit, those who were sent, so to say, into the short-term employment scheme. So a very asymmetric effect on the mental health. Among the female, it's in particular the self-employed. Among the male, it's more among the employees. And again, we further look down to what extent the regulations are one reason for this specific effects. And we again observe for the females who were affected by the regulations, we see a strong increase also in terms of their worsening of their mental health. So to say, when they are not allowed to work, they really face much worse a much worse situation in the mental health. So that when we put together the whole picture, coming to the conclusion, so to say, we revealed with our analysis, first of all, that the self-employed are more likely to experience income losses than employees, first. Second, that the women in self-employment are more likely to experience income losses than the male counterparts. Among employees, there is no such gender difference. The stronger effects for self-employed women are because they work more often in those industries that were more severely affected by the pandemic. And we find strong evidence for the channel. It's the restrictions and the regulations which drive this result. And last but not least, we find that women experience an increased psychological stress, which needs to be addressed in general in the future when we look into such pandemic crisis, that this also has to be taken into account when talking about health effects in general. Let me come to, let's say, kind of policy advice, which is of course, very much driven by the German experience. In Germany, the 8 packages which were done for the self-employed were, let's say, many aid packages. I think we reached now the 7th aid package, which each of these aid packages having different ways of access, different things be covered. And one can also say that almost each aid package came in with more things to be shown, to be proven, to get access to it. Given our results, we believe that the easy access to such health packages and aid packages should be discussed. Also, what becomes much more important than has been discussed so far is the reliability, how to use the financial support, becomes a crucial issue. We observe, and this is only anecdotal evidence, that that self-employed are keeping the money from the aid packages in the bank account because they are also unsure how to use them instead of spending them. Increasing, so to say, also when we think of mental health issues, this insecurity. And last but not, and the third part is the speed of granting support methods. Again, we observed a lot of changes. The first emergency aid package was granted very fast, and with each aid package, the time between applying for it and the grant increased a lot. Currently, in May, they are just finishing the aid packages which were dedicated for November and December last year, so that we are now facing a 5 months delay between application and granting. Two more parts on this, and then I would close. Also, with respect to the payments, so far these payments were done as one-time payments covering several months. There is certain incidents that would be much better to make payments for those months where the self-employed are hit very strongly, become, so to say, very focused. And the last part here is the coverage of living costs versus only covering fixed business costs. In Germany, the self-employed are getting only fixed business costs covered and simply are, despite their huge income losses, not able to use this aid packages to cover their living costs. And in particular, the smaller self-employed, the solo self-employed, and those who have only 1, 2, 3 employees are desperately in need of also being able to cover the living costs. Last policy advice, given that this is a very strong effect on the self-employed, and in particular more strongly affecting the female self-employed, which were catching up for the last 20 years, but still are having lower shares in self-employed than male self-employed. And given that our first forecasts show that probably about 20 to 25% of the self-employed people will give up now after the second wave of the pandemic, or have given up already, we need to think about scaling up again startup subsidies in order to support those self-employed which were hit hard by the crisis, which have given up or which lost, so to say, the opportunity to generate their own income during particular second wave of this crisis. That's from my side. Thank you very much. Thanks for having me invited to this excellent workshop. Thanks.
Thank you. Thank you very much, Alexander, for this very interesting analysis and methodology on the COVID-19 crisis of the female self-employed. And while I fear that the implications of the pandemic will be probably a longer lasting effect on employment, income, and labor, but I'll leave my speculations with me, and I'll give the floor to the questions of the audience. And we have plenty of time for questions, and we have one question first from Mirjana, and she's asking, according to your research, did women more often than men work from home in terms of crisis than pre-crisis? What is the future of remote work, in your opinion?
did more work from in terms of according to did women more often than men work from home in terms of crisis than pre-crisis? They worked more often from, so more women than men changed. No, sorry. With respect to working from home, it was that men more often than women changed to home working. So it's the other way around here. What we don't know whether they already in the pre-crisis level were working more often from home than men. But in terms of the crisis itself, it was more often men than women who changed into home office. The future of remote work, this is of course speculation. In particular, we need here, I think, to differentiate between employees and self-employed who are free to choose where they work. With respect to employees, we definitely can be sure that working from home will be the future question. It's not that working from home everybody makes happier or makes it more productive or makes it better, because we also know that working with others in an office with short ways and short possibilities of exchange are important as well. So I would say the future of remote work will be an increase of remote work, but this needs to be done on a very individual level and needs to be done also depending very much on what each company needs. With respect to the self-employed, still it holds the self-employed are those who are free to choose where they work, and certainly we will see them probably optimizing between working from home and working in an office or working somewhere else. They might change that as well.
Thank you. If the response was responding to the question, I'm sorry if I read the question wrong in the first instance, but it was indeed the other way around as I think I read it. Another question from Ionis. You may have mentioned it, but I'm afraid I missed it. Is your dependent variable a dummy? In other words, can you only identify income losses by self-employed, or do you have information on the size of the loss? It would be interesting to explore whether the results change along the earnings distribution. I would expect women to lay on the lower parts of the earnings distribution. Thank you. Not, yes, exactly.
Yeah. Okay. Since we were interested in the probability of an income loss in the first place, it is a dummy, because that's how we cover it. We also looked into the question among those who faced income losses, into relative and absolute income losses. Indeed, it is, as Yanis is saying, those men who are facing income losses, and they are facing this with lower probability. Those who are facing income losses face income losses, higher income losses in absolute terms. Females who are facing income losses are facing higher income losses in relative terms. So giving an example, let's say a female who earned 2,000 euros before now earns 500 euros, and the male, and so she lost 75% and 1,500 euros, and the male who earned 2,000 euros, 4,000 euros before might earn now 2,000 euros during the pandemic, losing 2,000 euros instead of 1,500 like the female, but only 50% instead of 75%.
Thank you very much for the answer. You still have about 15 minutes. We're a bit early, so you still have about 15 minutes from posing questions on this topic. Mariana just posted another question. There's a prediction that until 2035, more than 30% of workers will work on distance as freelancers, which I think is, yeah, it's an interesting estimation. It definitely will change some of the working habits that I also see on myself in the future of how we're going to be employed.
I mean, it's the important point here is, first of all, this depends very much on the country, I guess. And what is now the huge question, which is connected with that, is having at least experienced, and okay, Mariana, it's a statement, but still let me add, the question which we need to face now is, given, at least, and this is also again only talking for the German part, given that self-employed, in particular also the solo self-employed, experience worse support than the employees and are hit at the same time harder by the crisis than employees. How will they react? Will they try to avoid this kind of employment form? Will they start trying to get employed again, in particular females, given this strong effect among them? And how will we be in the future, so to say, able to react to, let's say, a flexible, the need of flexibility in the future way of working? And that points to the main part, the main policy issue which we have here. We currently, when we talk about the whole social security system, we talk about those who are employees and we talk about those who earn firms. The employment form of self-employment is so far not addressed in any let's say, particular sense by the social security system. And that means that we need to rethink the social security system towards this new employment form. And indeed, if the prediction becomes true that 30% of the workers will work as freelancers or solo self-employed, then this employment form needs new attention. And this is, so to say, one of the main outcomes of the crisis, that this employment form was not addressed in any specific way so far. In many countries, politicians try to put this employment form as close as possible to employees, but this is probably not the right answer. So we need to think how we can create a social security system which allows being able to work in this employment form, and what might be even more important is being able to change and move between the two employment forms back and forth. Because what we also know is that many people, in particular when they are solo self-employed, work for a year or two as solo self-employed, then they become again an employee for a year, and then they get again self-employed. And this change is very, very difficult to be covered by the social security system. And it is each time a hassle to change and move back and forth. And basically at the end of the day, losing access, for instance, to an appropriate pension when you get retired.
Thank you for the answer. And indeed, it was a statement, not a question, as I posed it first. Martin, I see your hand up, please.
Thanks, Martin. Thanks, Alexander. Very, very interesting analysis. And sorry if you answered my question already in the presentation. I just cannot recall whether you mentioned it. I'm thinking what you see is the effect of the pandemic, of the crisis on various variables. Yes, working from home or income, etc. Now, and possibly self-employment is, or presumably self-employment may be more flexible. More flexible form of work. What can we expect in as the pandemic? The pandemic is over. The kind of return to normal, maybe different normal. But what's your what do you think about it? Maybe will self-employment also respond sort of more flexibly, and will be coming back to the normal quicker there, or any thoughts about that?
Well, I think we will see two movements. I mean, self-employed, the important part is people who are, let's call them entrepreneurial self-employed, are those who will uncover now the new market opportunities. And of course, these are exactly those who fill in and probably have already filled in during the pandemic, but also in particular fill in as much as the pandemic gets, let's say, less of our everyday hassle, they will fill in new market opportunities. I don't believe that we will get 100% back in what was before, because we have seen already some changes. We will see indeed for cities and towns the big question: what will the center of the policy of each city and town look like? And this is also a question of self-employed, in particular when we think of small shops. This is a political decision. Do we want to support the life as it was before and have, let's say, a differentiated picture and a huge supply offline? Or do we want to go another way and have, let's say, less offline life and more online offers, and with the effect that the city centers change their faces? So this is a mixture of these two movements. We will see some of the old self-employed simply giving up, simply being desperate because they were not having any support and had no other choice to give up and do something else, and probably not come back. And the question will be, how will be these gaps filled? And parallel to this, I'm sure new markets will be filled in by new self-employed, by new dynamic people full of ideas covering these market niches. But where we see the biggest change is simply really, and even in Berlin we can observe it right now, main parts of the city, main roads, you can observe every second shop closed now, empty, where we really have to see how this will move on. Will there be new movements into it? Will the cities themselves support also new movements into it, or will we see a change also away from offline shops? Maybe the last part on it, this is something which is also a little bit lost usually. What we also need to know is among the self-employed, there's also a large share of people working in the cultural sector. About 80% of them are self-employed, and being in theater, operas, etc. And they're also now having no opportunity to work or have income for a year. And this is a different decision again, whether we would like to have, so to say, this broad offers of culture, or whether with some consequences on how culture is financed, to what extent, so to say, one would be willing to move away from these very high levels of self-employment towards a different kind of contracts with these people. So a mixture, some losers, some new gainers to be expected.
Thank you, Klaus. Go ahead.
Yes, so yeah, maybe more a remark to what Alexander just said than a real question to him, Alexander. I mean, we are talking now about self-employed and what the future of self-employment is. Yes, I mean it's clear since a while that solo self-employed might be a future perspective, but already in the past we have seen that the transition goes very, very slowly. Now, okay, in this shock now, of course, more people who are employed, normally regular employed or not employed or not working at all, see that maybe through the internet and the PC and working from home, one can enter the market, perhaps. Okay, so that's what you also said. I would say that I do confirm. But the other self-employed, I mean, they have worked anyway. I mean, it's only a question of the shift, more of a shift. But working from home was normal for self-employed anyway, I guess. I'm not a self-employed, but if I look at this market. And then the other issue is as you also said in your presentation, people who are self-employed have to meet mainly often or most of the time other people. And this will not change. So going out, not working from home, but working on the street or in an office or where others are, will remain central for the job. So it's more an issue what percentage of the full time people work from home and what from somewhere else maybe there is a shift. So I don't see so much for this, unlike for the normally employed. Yes, I could see more if digitalization really takes place. And even there, I mean, Germany hasn't made one step ahead in the last year on digitalization. We just see chaos everywhere. We see how slow, things are going. So yeah, but well, let's hope it goes faster, but then more people can stay home and combine work with family and more flexibility, but it will take, I'm afraid, quite a while. So my immediate guess would be the next years there would be not happening so much. Maybe I'm completely wrong, but my prediction would be not so much will happening. People just move back to where they were. Yes.
Those who can will move back to where they were. Those who gave up, and this is a large and not too small number, I guess it's really already 20 to 25%. Here, the big question is, can we give them a good reason to move back? And this is, for me, the big political discussion. And I mean, just giving a number, we started with 3 million people in 1990. This increased to 4.3 million in 2012. So a slow increase of 1.3 million. And now we are with one hit back to a little more than 3 million, probably. And this is also the crucial part. How can we make it attractive to them to go back? Because many of them, and this is of course only anecdotal evidence, tell us that the way how we were treated during this crisis was so unacceptable that this employment form, we are done with this employment form now. And of course, this is also a little bit, then again, the answer to Martin, then probably others may come in, but whether this will be the same share, this is probably the big question. I doubt that it will be the very same share as those who were now in this employment form and left it. And this is, so to say, the cost which we have then to pay, this differentiation of market offers, which will get lower.
Thank you very much for this very lively discussion. I think we have perhaps time for this one last question that was posted by Yanis. He says, you mentioned restrictions. Were these introduced by the state, and while the employer were compensated to some degree, the self-employed were not? Well, this is sort of phrased into a question. Were the self-employed not? Mm-hmm. Is there an issue of underreported earnings amongst the self-employed in Germany? Do you have any information on that one? Thank you.
Yeah, the restrictions were introduced indeed by the government, simply saying shops are closed, theaters are closed, you're not allowed to go closer to 2 meters, etc. So these are the government related restrictions, which were probably all over the Europe relatively similar. And indeed, here comes in the German part, or not only the German part, I would say most European countries have it now. The employed in the first wave, in the second wave, the employed were almost not affected by the closures. But the employed were compensated with this kind of the Kurzarbeit, the short-time compensation scheme. If Yanis, if you are in Greece, this is also introduced in Greece even now. And the self-employed exactly were only having received some financial support in terms of covering their fixed business costs. So the support which they received, in contrast to the short-time compensation scheme, which you get in and you can do what you want with it, the money which you received from the government as a self-employed was money which you could only use to cover fixed costs like rents. But you were not allowed to simply say, fill in your refrigerator. And this is why people were so upset. And this is also where a change happened in the very beginning. Until March 30 of the last year, the very first aid package also was allowing covering living costs on April 1st, that when the regional support aid systems were replaced by a federal support aid system. This was changed to only covering fixed costs with this emergency aid. So that the self-employed faced, so to say, when compared to employees, strong disadvantages. The reason which was given is that the employees pay into the social security system by paying unemployment, the unemployment premium, or you call the unemployment insurance, sorry, and that this short-time work compensation scheme is covered by the unemployment insurance. The limitation here is that also the unemployment insurance was not having enough money to cover all these expenses of 8 million people being sent into short-time employment scheme. So that also tax income had to be used to pay it. And of course, the self-employed do also pay taxes, and we're clearly claiming if all people are getting support which covers living costs, why shouldn't we also get it? The last part, and this is a controversial which is going on until today. It has been discussed very, very controversially in Germany, very controversially. And I don't think that the government made very wise decisions in that direction. With respect to underreporting, of course, underreporting issues do probably exist everywhere when it comes to self-employment. This is something, of course, which when it comes to help systems, emergency aid help systems, could also be addressed in a very simple way. And I can only refer to the British way of helping the self-employed. There, the self-employment scheme, the support scheme for the self-employed was depending on how much you declared in income month by month in the previous year. And this is also what we always were suggesting. Instead of making some kind of emergency aid, some packages independent of what your income was, make a clear emergency aid package where you use each month of the previous year's income, which you reported to the tax offices, and calculate, given your current income loss, the emergency aid level which you pay to each of these self-employed. So that, in other words, the financial offices who receive month by month your sales have the best information to also develop a help system for the self-employed, where they say each month of income losses due to the pandemic can be addressed by us as the financial as the tax as we have tax information on your previous year's incomes, on previous year's monthly incomes month by month. This is a suggestion which we placed many times, but where the German government said, without asking even the tax offices, that we don't have the capacity to do such a support scheme.
Thank you very much for the response to this question. And now that we don't have any further questions, I would like to pass on to Martin and Klaus for their closing remarks. Klaus, would you wish to start?
Yeah, I can and wish. Thank you very much. Thank you all for the lively discussions. The setting was as a whole for Academia Europaea. First was complex because first we are normally an inner circle, which only few people meet who are members of the committee, of the section. Now today we had not only opened up the audience, but also made different offers, packages for the morning and the afternoon. So all in all, we had a quite nice and lively and strong response. But this was also because we had 4 excellent contributions during the day, and I'm quite happy with this experiment we have undertaken. Maybe possible to replicate again. We also enjoyed, of course, for another time, the strong help of the Central European University on the technical side, but also at the side of the moderator. You have excellent moderators, not only this time or the last time. And of course, it's good to have a strong institution backing up a certain event. So I mentioned that in the morning, the idea was to show that if we add handbooks, then that also fulfills the message of the task of Academia Europaea and any Academy of Sciences to bring together and evaluate research. That was the morning attempt, and I replicate what the offer is. Look at the GLO website if you would like to contribute to the huge venture. It's a challenging task to write a chapter, but if you want to investigate what could be done, drop me a note and we can communicate. Second, well, the afternoon was, as I said, was frontier research. I can say this because I have seen the papers before in various forms. That's why it was easy to convince the authors to present today. Beyond the fact that Martin is also a member of the selection committee of the section, also the central committee, but and the local host, so to speak, whom I have to thank a lot. But also the 2 papers have been GLO discussion papers. So if you want to read heavy forms of the material, you can recently published as GLO discussion papers, and that's what is the secret I can tell, because it's true. Both papers have been accepted for publication in the Journal of Population Economics after heavy refereeing. The poor 2 groups of researchers have suffered quite a lot at short notice, and also the referee suffered. Okay, so but I have to reveal that some people say, "Oh, people are not working hard under COVID-19." Say, "Oh, I have so much to do with the challenge. We can no longer work on papers and on referees." We have no problem to find referees also for shorter hard work. So people feel committed to contribute. I think that's very important as a spirit of we scientists and academicians and whatever we are. So both papers are not yet listed anywhere as forthcoming, but not at least at the journal website, but they are in production. And so I have to thank also both authors and their teams for in my role, which some people may not know. In my other head, I have a few heads. Okay, yeah. So I am becoming bold, so I need heads. Okay, so now, yeah. So I would like to thank everybody for contributing. In particular, of course, Martin Kahanec and his team, who gave us the wonderful background, and we see this wonderful building behind Martin. And so we hope that we next time can come to the physical place, Vienna and the institute. Okay, Martin, if you want to say something. Thank you very much. We see us soon in other places.
Thank you very much, Klaus. Nothing to add, really, just to thank you for facilitating this, for suggesting and for staying in touch with us and with the Central European University and School of Public Policy. This is excellent occasion to meet and to discuss these interesting topics. And And of course, when the pandemic situation is better, you'll be most welcome all to join us physically in person in Vienna. Thanks very much to Martin, fantastic job as a moderator, and also to Inji, who could not be present, but she has prepared much of the material and the event. So thanks to her as well. And of course, the audience participants who have been with us today. Thank you all, and wish you all the best. Stay safe and have a lovely rest of the day and week. Thank you. Thank you. Bye.
Bye-bye.
Thank you very much for having me invited. Bye-bye.
Thank you. Bye-bye.
Bye.
Thank you. Thank you. Bye-bye.